I love my job. I love coming to work every day. At night, I dream about eyes. I always look forward to meeting new patients, learning about them, and helping them with their problems. My name is James Lehmann. I was born here in Texas, in Fort Worth, while my dad was in the Air Force, but I grew up here in San Antonio, in Seguin actually, and I went to college at the University of Texas at Austin, so go Horns. Then I did medical school here in San Antonio at the Health Science Center, and after that I went to Dallas to do my residency in ophthalmology at UT Southwestern, at Parkland Hospital, which a lot of people know about Parkland, and also I did my cornea training there as well. I learned to speak Spanish, well, a little bit growing up. Both of my parents are from Eagle Pass, and so they grew up speaking English and Spanish, so I heard it in the home all the time. But I also studied in Spain, and I took it in college as well. And I've traveled a lot in Latin America, so that's pretty much how I learned Spanish. Why did I want to become a doctor? Well, I was always a good student, and growing up, everybody said that, hey, you should be a doctor. And so I always thought that would be a good idea. And when I went to college, I took classes, and I was an English major, and I always liked writing. But I like the idea of helping people, and I like the difficulty and the prestige involved with being a doctor. So I went to medical school and then chose ophthalmology after we did all of our rotations and everything. So it was my favorite of the subjects I studied in medical school. You know, when I was a resident and more in my fellowship, I had a couple of attendings that kind of that I admired. A guy named Wayne Bowman. He's an ophthalmologist there at the University of Texas Southwestern. I always liked the way that he interacted with his patients, the care and the time he took with them. So I would say he was a good role model for me. You know, the field of ophthalmology is changing every day, and it's hard to keep up with all of the advancements. So what we do, not just myself, but the other doctors here at the practice, is we attend meetings regularly, our national meetings. I go twice a year. We also use a listserv where we interact via email with other doctors to kind of ask questions about tough cases. And we like to hire new doctors every few years because they will bring you the new technology and kind of the new ideas. And so I feel like if you surround yourself with people that are motivated to stay up to date and that are young, that you will kind of stay up to date with everything. Another way that we keep up to date with the latest advancements is I'll read journals, just like most doctors. And sometimes if I'm in a rush and I'm eating lunch by myself, I'll have a journal there in front of me and I'll read that. I am a board-certified ophthalmologist, which means I stay up to date with all the new technologies. We also have to be retested every several years. Yes, I do charity work here in San Antonio. I donate my time at the Haven for Hope. There's a free eye clinic there, and I perform free cataract and pterygium surgeries there. I do international charity work as well. 2 to 3 times a year I will go for a week at a time to teach local doctors the new techniques in cataract and corneal surgery. I've been doing this my whole career. One of the most exciting things that happened, not exciting in a good way necessarily, but I was in Haiti doing a medical mission trip when the earthquake hit, and I'll never forget having to, to get our staff and everybody out of there. It took us 3 days to be evacuated from Haiti. We had to get our staff to the airport, the injured first, and we got people out in waves. And eye surgery kind of takes a back seat when people are suffering that much and have broken limbs, and it was mostly just getting our people to safety. Our practice has been in San Antonio for over 50 years, and we've kind of morphed into more of a surgical practice. So here at Focal Point Vision, we take care of patients who have medical problems with their eyes. So we don't do routine eye exams. We take care of patients who are referred in or come in on their own who have a serious medical problem, something like a cataract or corneal problems. Oftentimes that requires a surgery to fix it, but not all the time. So kind of in summary, we take care of patients when they're having problems with their vision, not just routine eye care. We take care of all kinds of patients. If a patient calls up and wants an appointment, if they have a medical problem with their eye, like they're not seeing well, we are happy to see them. But we see patients for diabetic eye exams and anything associated with decreased vision. Sometimes we see patients that only have one functioning eye, that the other eye had trauma or they don't see out of it for whatever reason. Those are very challenging cases. They come in with a cataract and they've delayed surgery for many years because they're afraid. So they have a very dense cataract, and it's always a very difficult case. Those are the most rewarding. I had a lady last month very similar to that. She had a very dense cataract, and we did the surgery, and then the next morning she was able to see better than she had in years. Those are very rewarding for us. You have to first alleviate the patient's fears because this is their only eye, and also you have to do good surgery. So for me, that's kind of the most pressure-packed moment and also the most rewarding. Another case that comes to mind was a patient, we'll call him Mr. H, who currently is in his RV driving around the western United States because of successful surgery that we were able to do on him. He had not only cataracts, but he had corneal dystrophies in both eyes, and he did not see well at all. He wouldn't have passed his driver's license test, and we were able to do 2 surgeries, one in each eye, was a combination of a cataract and corneal transplant with the latest techniques that we know. And a month later, he was able to drive his RV across the western United States. And he called me from Oregon the other day just to let me know how happy he was. I spend quite a bit of time in the office, and I'll be seeing patients, and we'll receive a call sometimes about a problem that needs urgent care. We're very open to seeing those patients. We'll see them on the weekends at any hour. We have doctor on call all the time, and we're very used to handling those kind of emergencies. You hear every day that the cost of medicine is rising, and everybody knows it. Your insurance premiums are going up, and everything seems to cost more money. Here at Focal Point Vision, we are cognizant of that, and we are mindful about what type of drops we prescribe to patients. We try to do generic drops if possible, and we have ways of getting patients assistance with their medical fees if needed. If somebody needs something, we can make it happen. Patients come in and say, I'm tired of wearing glasses, so what can we do to help them? Well, we also perform LASIK. I myself have had LASIK. I had it 3 years ago, and I'm definitely a happy camper. I used to wear glasses all the time. Now I wake up in the morning, I can see, I can swim and do all that. So here at Focal Point Vision, we offer the latest in refractive surgery. We do LASIK, PRK, and we can treat a wide range of prescriptions. Sometimes when we're discussing cataract surgery with a patient, they ask, will I have to wear glasses after cataract surgery? And now the answer is most patients do, but there are some technologies that we offer here at Focal Point Vision to help reduce a patient's dependence on glasses. These are things like special lenses that either have a multifocality or they can move somewhat, and we can find the right match for the patient so that they can reduce their dependence on glasses. Another thing that's special about our practice is the teamwork between myself and Dr. Maverick. I didn't know him before I joined this practice, and now I've been here for 10 years, and he's like a brother to me. We're the co-owners of the practice, and we even get together on the weekends with our family and our kids. We enjoy each other's company that much. My duty to my patients, it can best be summarized as treating them as I would want to be treated. So I have to think about what's in their best interest, respect their decision making, and essentially treat them like a member of the family. Do what's best for them.